Welcome back to the Popkin Method, the show where real medicine meets real results. If you've ever had blood work done only to be told everything looks normal, but you still feel tired, foggy, or off, this episode is for you. Today, Dr. Popkin is revealing to us the 4 labs that most doctors tend to skip and why they make the biggest difference between surviving and thriving. So let's start right away with the frustration. Patients come in all the time saying, my doctor told me my labs are normal, but I still feel terrible. Why do you think that this is so common?
Well, the problem is that the doctor is only checking standard lab tests that are covered by the insurance company. Annual tests like CBC, complete blood count, CMP, comprehensive metabolic profile, basic lipid panel, total cholesterol, LDL, HDL, triglycerides, TSH for thyroid, PSA for the prostate, a urinalysis. They're not routinely checking hormone panels for men and women. They're not routinely checking inflammatory markers like HSCRP or SED rate or antithyroid antibodies. They're not routinely checking advanced lipid biomarkers like Lp(a), homocysteine, small dense LDL or oxidized LDL. They're not routinely checking micronutrient profile for nutritional deficiencies. They're not ordering food allergy sensitivity testing. They're certainly not doing any genetic testing like MTHFR to determine your methylation status, ApoE for your Alzheimer's status, etc. So, essentially the testing is limited. So too is the information that you get. Therefore, it's part of the explanation why most people don't get the answers from the labs that their physicians order. They're just ordering basic lab work. It's not covering most of what the patient is actually going to need to determine what's wrong with them.
So in your experience, what's the biggest limitation of the standard labs that are offered and most people tend to get in primary care?
Well, as I said, the standard labs have their limitations unless you look deeper. For example, 50% of people with heart attacks and strokes have normal standard lipid profiles. Those standard lipid profile include LDL, which is your bad cholesterol, HDL, which is your good cholesterol, a total cholesterol, and a triglyceride. So an advanced lipid profile is necessary to detect the cause of the other 50% of heart attacks, like Lp(a) or homocysteine or small dense LDL, stuff like that. Also, I like to check a coronary artery calcium score to further define the patient's cardiovascular risk. Another example, let's say even if genetic panels are being done, they have their limitations because they only test a few genes versus doing, let's say, a whole genome sequencing of all 25,000 of your genes. And even if you do the whole genome sequencing, the limitation is how you process and act on the information that you get. So any testing is very provider dependent. So, as you can see, there are lots of variables and it's very nuanced. So your care team needs to put in the work to get the answers you need and order the proper tests.
So let's walk through the four labs that you say are often missed and the most important ones. Starting off with the first lab, what's the first test that's missing in 90% of routine panels, and why should everyone ask for it specifically?
Well, I'd say the first test that I'd look at, it's not one individual test as much as it's testing for insulin sensitivity or insulin resistance, which is what eventually leads to obesity and eventually into diabetes. So I don't only test for, let's say, fasting glucose to look for insulin resistance, but I also test for hemoglobin A1C. I look at insulin levels. I check an oral glucose tolerance test to see how the patient will handle a glucose load. And I look at C-peptide levels to assess pancreatic function. And all of these tests determine where the patient is on the spectrum of developing metabolic syndrome, which eventually leads to diabetes, which increases the risk of heart attacks and strokes.
And what's another overlooked marker that can signal early dysfunction before it becomes a diagnosis?
Again, I'd have to say adding an advanced lipid profile test to the standard lipid profile test to determine and detect the 50% of heart disease that occur in patients that have normal standard lipid profiles. Lately, there's been a lot of talk about LP little a and homocysteine and other inflammatory biomarkers that I've been testing since the beginning of my career, almost 25 years ago. And it's important because heart disease is as much about inflammation as it is about cholesterol and other damaging lipid particles. So we have to look for these dangerous inflammatory particles in the blood and do a deeper dive into what your advanced lipid profile looks like. For instance, the LDL or bad cholesterol must be of the small dense type, and it must also be oxidized to enter the vessel lining and cause a plaque. So we must therefore we have to look at the particle size and the oxidative status rather than just the number of LDL particles, which is all a standard lipid profile looks at, making it less helpful in properly diagnosing the potential for heart disease. So we've got to look at not just the overall number of LDL particles, but the type and its oxidative status.
Now, what's one lab that's especially important for energy, hormones, or metabolism, but also rarely ordered?
Well, that would be simply testing men and women for their hormone status. I'm seeing men in their 30s that have testosterone levels in the 200s, which is quite low, which is something I would expect to see in men that are much older. And as far as women are concerned, women are also having hormone imbalances at an earlier age, as well as, leading to uncomfortable symptoms and weight gains. This is likely due to a number of factors, including microplastics, toxins, and other endocrine disruptors that decrease hormone production, which is why it's important to check the patient's hormone status. It'll tell you a lot about why they're having the symptoms that they're having.
And what's the one lab that often explains vague symptoms like mood swings or inflammations or like sleep problems?
Well, there's a bunch of tests for this, and one of them that I like to do is a genetic test for something called the MTHFR gene mutation, which has multiple health implications, one of which is for mood disorders and cognitive impairments. And the MTHFR enzyme, it supports several vital functions in the body through a process called methylation, including converting folate into its active form, which is methylfolate, methylated folate. It supports DNA synthesis and repair, so it's quite important to prevent cancer. Helping regulate homocysteine levels, which we'll talk about later, is an independent risk factor for heart disease. Also contributes to neurotransmitter production and assisting in the detoxification process of the body. So it's quite an important enzyme system. And when it's functioning optimally, this gene helps maintain proper methylation, and methylation affects numerous different bodily processes, including mood regulation, energy production, immune system function, the body's ability to detoxify chemicals and toxins. It also is involved in nervous system health. So the importance here, the connection between MTHFR and mental health involves a really complex biochemical pathway or multiple biochemical pathways. So when the mutation affects folate processing in particular, how the body converts folate into its active form, it creates a cascade effect. And this is where we start to see symptoms, right? For instance, decreased serotonin production. And when you have decreased serotonin, that impacts mood regulation, sleep patterns, and anxiety levels. It also affects dopamine balance, so it has effects on motivation, focus, attention, influences the reward systems of the brain. We see a lot of this in patients who have ADHD. It also affects norepinephrine regulation, so it has impact on energy levels. It affects emotional stability, has an influence on anxiety responses. So patients that are living with the MTHFR gene mutation, they require a fairly comprehensive approach to mental health management. And understanding the patient's unique genetic profile, it really opens the doors to more effective treatment strategies. And this is important. We follow this and we look at this clinically because there are two different clinically significant gene mutations that up to 40% of the population have. And one of these mutations actually decreases the MTHFR enzyme function by up to 70%. And it makes making the methylation process quite inefficient and leading to the patient's symptoms, as I mentioned earlier. So as you can see, it's a quite common gene mutation, and the symptoms of fatigue and depression and anxiety and lack of focus are quite common. So if we know the patient's MTHFR status, we know their methylation status, we can put together programs that include methylated B complex vitamins, so the patients can get the active forms of the vitamins in their system, and for them to do the things that they're supposed to be doing. Recent research actually shows that combining nutritional support, lifestyle modifications, and proper medical care creates the strongest foundation for mental wellness rather than just randomly prescribing an antidepressant. And you see this all the time. Patient comes into the office, maybe they are depressed, or they have anxiety, or they have ADHD symptoms, and they just randomly get prescribed a prescription medication without doing a deeper dive as to see if the medication will actually help them or not. So, and the key to successful management lies in finding the right balance of supplements and lifestyle modification, and medical interventions. We do prescribe medications as well. That's not to say we're only using holistic approaches, but this holistic approach helps ensure the long-term stability and improved mental health for patients. So what are these nutritional interventions, right? What vitamins and supplements are we using is probably the question I'm leaving you with here. And people with the MTHFR gene mutation often require specific nutritional support. And the supplements that I like to use for these patients that do have this mutation would be L-methylfolate, which is essentially the premethylated active form of folate. So we're actually premethylating it for these patients, putting methyl groups on them so the body can actually use them. Methylcobalamin, which is the active form of B12. So you hear people all the time saying they got a B12 shot and they felt more energy. We use something called pyridoxal 5-phosphate, which is the active form of vitamin B6. Another product called SAMe, SAMe, which is adenosylmethionine, and omega-3 fatty acids. So these are, really common supplements that can help people out that have these MTHFR gene mutations. And it could actually help their symptoms without using prescription medications, or it'll help make the prescription medications much more effective. So it's better when it's done in a comprehensive program. So, as you can see, testing for this really common gene variant can have a significant implication on how we treat mental health issues rather than just blindly prescribing an antidepressant.
Absolutely. And these labs seem so important. So why do you think that more doctors don't order these? Do you think it's training or insurance or time or something else?
Well, the answer is all the above, right? Physicians are not taught how to use these tests in traditional training programs, and they certainly don't know how to incorporate the results of these tests into downstream care plan enhancement. Makes it exceedingly difficult when they're, seeing a patient every 15 minutes. How do you incorporate all this information in there? So there are a lot of factors that get involved in this. Health systems, they certainly don't see the benefit in integrating these modalities into their revenue cycles, as they're more resource intensive, right? They require increased human capital to test and treat, spend more money on these tests, and it's easier for them to just prescribe a medication and hope to get it right. In my practice, hope is not an option. Put the work in that needs to be done for my patient. I find out what's going on with them, and I prescribe the right combination of everything from lifestyle modification, diet, exercise, supplementation, prescription medications, whatever is needed. You just have to do the proper testing to find out what needs to be done. Eventually, I think AI and machine learning will be incorporated into testing and treatment protocols. But until then, make sure you find the right provider to look after you for your healthcare needs.
What would you say to someone who thinks if my insurance doesn't cover it, it must not be necessary?
Well, I hear that a lot. And I'd say the answer to your question is that these people have been thoroughly brainwashed and gaslit by the traditional healthcare model. And they should take a more proactive approach to their health in order to advocate for themselves. This is where people need to make the financial investment in their health and find the right provider who knows what to look for, what tests to do, and what to do with the results of those tests.
And when they get these results and once the labs are done, how do you integrate them into personalized care plans for patients?
Well, that's the art of practicing medicine, and that's where the Popkin Method comes in. I start with the same framework I always use for everybody, which is a thorough history and physical exam, basic and advanced lab tests. I do appropriate imaging studies. I do appropriate follow-up care, and I create a comprehensive care plan and a program to address their needs. It's not just one. It's not one simple fix. It's an entire program. And like any other care plan, it includes lifestyle modification, diet, exercise, the appropriate supplements. I like to use certain peptides in appropriate situations. Hormone modulation, make sure patient's hormone status is optimized, and when necessary, stem cell and exosome therapy and management of prescription medications. Without an integrated care program, any testing is useless unless actionable changes occur.
So I'm sure you have a few different cases that may come to mind, but can you share a quick case story of a time when one of these tests really revealed something that was game changing for a patient of yours?
Well, I'll give you 3 common case stories, not necessarily individual cases, because they apply to so many people. And I'd have to say the first one I'm going to go back to is doing advanced lipid profile testing instead of just doing standard lipid profile testing. And then adding in a coronary artery calcium score to properly identify and risk stratify patients against heart disease. Remembering that 50% of patients that have heart attacks and strokes have normal standard lipids. So what is causing the other 50%? And that's where you have to do the advanced lipid profile and inflammatory biomarker testing. So I'd say that's one of the prime examples that I see all the time. I have a couple more that I see all the time and that I use all the time. The second would be doing MTHFR testing, as I discussed, and adding PGX testing or pharmacogenomic testing to better diagnose and care for patients with mental health problems, rather than blindly prescribing antidepressants or anti-anxiety medications or antipsychotic medications. Without these tests, it can take some patients several years to find the right combination of medicines to treat their mental health issues, which is unacceptable given the tools that we have at our disposal. With the proper genetic testing, the pharmacogenomic testing, we can look to see, based on the patient's enzyme clearance systems and their genetics, what medications will work based on their body versus other patients. So we can prescribe the medications based on their genetics and not just guess as to what might help them. And a third, I would say, would be assessing the level of a patient's insulin resistance. I'm very involved in determining how well a patient processes glucose and what their insulin resistance patterns look like by testing not just fasting glucose, which is included in the standard profiles, but also doing an oral glucose tolerance test. I'll check a hemoglobin A1C as well as insulin and C-peptide levels, all of these things to determine the patient's risk of developing metabolic syndrome and diabetes. And by doing so and preventing metabolic syndrome and preventing diabetes through all the lifestyle modifications that I talked about, and diet and exercise and supplements and medications, what we do is we mitigate the patient's risk of developing heart disease and strokes by controlling the insulin resistance. And you can also make a strong argument regarding neurocognitive illnesses like Alzheimer's, which is greatly affected by insulin resistance. And without these tests, patients can go years with insulin resistance and metabolic syndrome before they're eventually diagnosed with diabetes. And instead, by doing this testing, we can treat the patient and prevent them from developing diabetes altogether, and preventing the complications that come with diabetes, most notably heart disease, kidney disease, blindness, and strokes. So, as you can see, the treatment plan is only as good as the testing that's done and the actionable changes that are implemented into the care plan. And if any of what I talked about resonated with you, feel free to reach out to me and schedule a consultation. I'd be happy to discuss this with you. You can access any of my functional medicine programs virtually via my telemedicine platform, or you can see me in person in my Hollywood, Florida office. You can message me at thepopkinmethod.com or on any of my social media platforms, including Facebook, Instagram, LinkedIn. And I look forward to talking to you soon.
So this was all really good information and a lot of very important information, but I'm curious about the insurance aspect and getting the test specifically. So for example, if I felt like this resonated with me, and I'm sure a lot of people who listen to the podcast probably think it resonated with them as well. So let's say I want to go have this blood work done and get these labs done. If I were just to walk into, let's say, a Quest or any diagnostic center and request the test be done, and it's not covered by insurance, would they be able to give me that testing? And then if they did provide me this test and I do have this blood work, what would I even be able to do with those labs afterwards? Like, what direction would someone go in?
Well, that's a good question. And people do this all the time. And there are lab facilities that will take patients that just walk in and pay cash for the test. You don't need a doctor's order. You're ordering like you're ordering at a fast food restaurant. You say you just check off the test that you want. They charge you a cash-based price for it, and they don't need a physician's order for it. And then they run the test and they give you the results, and now you're left holding the bag, responsible to do something with it. So people in that particular case, they do a couple different things. They will Google the answer to, try to find out what what this particular test means, which I don't recommend people doing. They'll take the blood work to their primary care physician or to another physician and try to have them interpret it, in which case they should be able to if they're their doctor. And they've already paid cash for it, so there's not like there's an insurance issue with it. But as far as insurance goes, to answer your other question, the insurance company pays for labs based on your particular diagnosis and the diagnosis code. And some of the tests you can't get done unless you have the disease, which is kind of counterintuitive because you want to prevent the disease from occurring. Some of them you can get done if you have symptoms of the disease but don't actually have it. So it really requires your physician to know the symptoms that you're having, to know what diagnosis codes to use in order to get that particular test covered, so you don't get a bill from the lab for a huge amount of money. So there's a lot that goes into it, and it's frustrating for patients, and it's frustrating for physicians as well. I don't like not being able to do something for a patient because they are because their insurance won't pay for it. If something needs to be done, I'm going to do it. And we'll deal with the money part of it later. Most laboratories have separate cash pay prices as well. So in that particular case, you can talk to your doctor and they can order the tests for you cash, and then they can interpret the results. And if you tell them you want a particular test done, or if there is a particular test that your insurance company won't pay for, there's a cash-based option as well in your physician's office. And it's just a matter of getting the tests that need to be done. And if you think about it, a lot of people spend money on a lot of stupid things. And when it comes time to spending money on their health, they all of a sudden, they're not interested in spending that money. But there's people that spend money on far worse things like cigarettes and alcohol and other types of things. So if you want to use your money wisely, definitely investing in your health is a good investment.
Absolutely, because just being able to digest the information even a little bit deeper, like this gene mutation, it can have so many different implications. There's so much that goes into this. So it definitely seems like it's something super important. But I think the best question was, you have this blood workup, you have this panel, now what do you do with it? So it's good that you are such a resource, because now, I mean, I'm going to bother you about this afterwards, but I know so many people this probably resonates with, especially even just, like the mental health portion of it, especially ADHD and all these things that are common in mood regulation and fatigue. So it's great that, you'll be able to be a resource for people who want to test this out. So, like you said, not all doctors have the time, or they might not even have the particular education on this specific gene, or, things of that nature. So it's good to even have this information available. I know I'm very intrigued by this. I'm like doing my research on how much the test costs right now. But yeah, no, it's definitely like valuable, because it's so many things. Like the list just goes on, and dopamine balance and serotonin production. There's a lot.
Yeah, I appreciate you saying that, because it's extremely nuanced, and the patients, with all the information we have available right now, patients are really taking it upon themselves to do the research. And a little information can be dangerous in some cases, and it's always best if you are working with your physician. And many times, patients will suggest things to the doctor that the doctor may or may not have thought about for no fault of their own. It just maybe didn't come up, or perhaps they weren't thinking along those lines, and then the patient did some research and wound up, either giving the doctor the idea of what to test, or like you said, just go, just walk into a lab and pay cash. And like you said, what do you do with the results? Well, if you're working with your doctor, regardless of who paid for the lab work, you should be able to get the testing done and have it interpreted by somebody who knows what to do with the results. And that's the most important thing. Any test that you do that you don't act on, if there is an abnormality, it is just a wasted test. And we have so many opportunities and so many resources to check for things, and to treat and make people feel better. So the patient has to advocate for themselves. They are part of the care team. They do have to invest their time and energy and money as well into their healthcare, and do not rely on your insurance company to guide you with that. Because, like we talked about earlier, just because the insurance company does not pay for it does not mean it's not important. And there are so many things that are not paid for by the insurance that need to be checked. So it's real important, find a really good provider who will spend the time, sit down with you, talk to you about your symptoms. We'll do the appropriate testing that needs to be done, and we'll actually take the results and do something with it in a comprehensive program, not just writing a prescription for something. And like what I do, again, it's lifestyle modification, diet, exercise, supplements, peptides in appropriate situations, hormone balance, stem cells, exosomes when necessary, and medication management.
Yeah, absolutely. And it's kind of surprising that even the first lab you mentioned about insulin sensitivity and insulin resistance isn't one of the panels that are included, because obesity and diabetes are so common in this country. So that's so surprising. So thank you for shedding light on all of this. I have a feeling a lot of people will be reaching out to you after this.
Well,
But
I hope so, because, when you look at 60 to 70% of Americans are overweight or obese. And what happens when you start to gain weight, and you're heading towards metabolic syndrome and eventually diabetes. By the time we diagnose diabetes, the patient has had insulin resistance and metabolic syndrome for years. And during that time, their sugars may have been normal, because they were just secreting so much insulin to keep the sugar levels low. That is that is the insulin resistant state, is where a lot of damage occurs to the body. So by simply checking an insulin level, If the insulin level is elevated, then you know there's a problem with insulin resistance, and that's when we need to intervene with lifestyle modification and diet and exercise and supplements to get the patient to be less insulin resistant, to get them to lose weight, to lower that insulin level, and then they won't develop diabetes. And now you've just solved the problem, and you've saved years and years of potential damage to the patient's body, and you've prevented a major illness that has severe implications, including heart attacks and strokes. So yeah, it all stems from doing the correct, appropriate lab testing in the appropriate clinical setting.
Absolutely. Yeah. Thank you so much for going even more in depth with those topics and those panels. So it's definitely very helpful. So anyone again who's listening, if this resonated with you at all, reach out to Dr. Popkin. And also, if you know anyone that has mentioned these things to you, if they are feeling sluggish or tired, feel free to send it to them as well. And thank you for listening, and we'll talk to you next week.